Welcome back YouTubers to my channel for an everyday life of an Aspie. If you're following me and you're new to my channel, I welcome you all with open arms. I'm Aspie. I'm all about creating mental health and awareness versus sharing my life stories with Asperger's syndrome, OCD and the other diagnoses that comes under that umbrella of Asperger's syndrome. I also talk about mental health and awareness with the tips and advice of how to manage some of these everyday mental health disorders versus other, mental health conditions that may come into effect that come in our everyday lives, as well as also on my other channel of the Beauty from Ashes. I bring out some wisdom, encouragement, pills of wisdom, knowledge and know-how based on my experience and everything else in between, so that hopefully I can be a support mentor advocate and not to judge you in any way, because I know what it feels like to be judged. So if you're following me and you're new to my channel, basically what it's all about right now, it's the Let's Talk series, as I said. Well, this one is all about the men's health, which I'm wanting to address to men and maybe just to their partners also, so that they can be aware of the signs and symptoms that their partners are showing regardless, so that they can seek professional help or second opinion regardless what it may be. So basically it's going to be a wide range of topics for this one about men's health. The reason why I'm doing this, before I begin this, is, as I said in my very first one, is it's because obviously there's not many awareness about men's health, or not much being talked about men's health in a way of addressing it more so that people know about it, so that we can actually know more of what's going on in the men's realm as well as the females, and also maybe just to be that voice of the many few that will actually share my knowledge of what I know of certain things that goes down in men's health especially, and hopefully in that we can take away something in a way of being educated and motivated to seek the help we need. Also, because at the end of the day, as we know, men don't like to ask for help, because of their pride or ego. Maybe it's embarrassment, who knows, but feel free to comment below if I'm actually, wrong there, or not just point out that I'm wrong, or just point me in the right direction to maybe why men don't seem to want to just seek the medical attention when they should so deserve. So just to be on mind also, even though I forgot to start in my very first one of the men's health, I'm no medical doctor. I'm just a normal everyday Joe vlogs, just doing her everyday life stories versus everything else that I feel to share right now, so that hopefully some of the tips and advice that I give to you on managing it and what have you will be of value and use to you. But if you see any signs and symptoms that I share of any mental health disorders series, or just any health theories that I wish to address to you all today, seek second opinion or seek second medical treatment advice, regardless of what it may be, so that hopefully that you guys can be able to manage what you can at this point of time. And the second part, obviously, of the Let's Talk Men's Health series, especially, just being on, as I keep reminding you all, that some of the stuff that I'm sharing will be based on the New Zealand side of things, because obviously, being a typical Kiwi, I should at least give you guys a lowdown in the New Zealand statistics versus whatever else I might find or can recall on the top of my head and have that, evidence backed up. So this one is obviously going to be all about, again, another form of cancer, which is the testicular cancer, which is basically your testes or your ball, whatever you guys name it, what have you. This one is the most common cancer, however, for men aged 15 right through to 39. So it's obviously, this one usually attacks basically the younger men, so to speak. And we need to realise that regardless of what all that, we shouldn't be afraid to ask for help regardless what it may be, and hopefully we know about it. So yeah. Okay, I guess the first thing I better start off with is what is testicular cancer. Okay, obviously, as I said, it's obviously the presence of cancer cells or cancerous growth in or on the testicles or balls or whatever you guys want to call it. Although many young men get diagnosed with testicular cancer, is very treatable if it's caught early enough. As I said, the earlier the better to treat it and prevent it. Most abnormalities or lumps in your testicles may not turn out to be cancerous, but if you notice it's anything unusual, get it checked out by a doctor pronto to really make sure it's not this. Okay, I know this is going to be really embarrassing or what have you on my part. What I'm going to say next in this stage is how to check your your balls. So you guys might laugh at this or what have you. That's right, but I'm open to actually talk it out to you just to be there. But this is no laughing joke, guys, obviously, because as I said, this needs to be addressed and hopefully you guys, can follow it through. Okay, to check your guys' balls, obviously, using both hands, roll one of your testicles between your thumb and fingers to check for any lumps or bumps. They can be smaller than a pea. Check all around the testicle. This is best done in a warm environment like while you're in the shower. Do not do it when you have an erection because that pulls your testicles up and makes them difficult to examine. Don't play favourites. Repeat with your other testicle. However, do this every month so that you know what have you. To know about your balls, what's normal and what's not, however, the first part of it is what's normal for your testes is, number one, it's smooth and firm, comfortable to touch. Number two, one testicle is slightly bigger than the other, obviously. It's like that for us woman's breast, obviously. One breast will be bigger than the other. Number three is the left side often hangs lower. What's not normal, however, just to bear in mind, is number one, lumps or swelling on one or both sides of your testicles. Number two, an area of hardness on one or both of your testicles. Number three, testicles may feel heavier than usual or have changed its shape. And number four is your pain or tenderness through it. Okay, who gets it? Okay, as I said before, for testicular cancer is obviously most common in young men between the ages of 15 to 39. It is very rare in older men, however, after that age group. It's not common what causes testicular cancer, but boys who were born with undescended testes are more at risk, however. Māori men also have considerably higher rates of testicular cancer than non-Māori men, which is a funny, well, not funny, strange fact that is. Getting tested. If you find any lumps, have hardness, swelling or pain in the testicles, make an appointment to see a doctor pronto, as I said, because there are two initial tests that doctors can do to test this out to overall testicular cancer or whatever else it might be, and they are your physical examination and number two is your ultrasound. So obviously in these two parts, in the physical examination, your doctor will feel your testicles like you should be doing, guys, once a month. Your doctor will feel them for signs of swelling, tenderness or hardness. The doctor may also feel your abdomen, neck, chest, armpits and groin for signs of enlarged lymph nodes to check for signs of cancer. Because obviously with the lymph nodes, from what I can call the lymph nodes are the ones obviously that's trying to attack the non-aggressive cells of what's not supposed to be there at that point in time. This could indicate you have testicular cancer that has maybe spread. They might also check your legs for signs of swelling. Blood clots can also be caused by testicular cancer, so bear in mind on all this. So, and the last bit of your testing, which is the ultrasound, the radiologist will look for unusual lumps in the testicles and scrotum. If there is a lump, the ultrasound will pinpoint exactly where, what size and how dense the lump is. Okay, if both of these tests do show these warning signs, then your doctor might recommend a blood test or biopsy where the sample of the lump is taken from to confirm if it is cancerous or not. Treatment options, last but not least, depending on the size and stage of the cancer, again, you will be offered different treatment options. For most men, though, the best option is to have surgery to remove the testicle with the tumour. This is simple surgery done under local anaesthetic, all done in a matter of hours. Don't worry, removal of the testicle has absolutely no effect on your fertility or testosterone levels. Many guys may think that, after removing the testes, if they're working with their partner to have kids, that they won't produce. That's just another myth with it. If the cancer is in later stages or has spread or a combination of the following that I've shared with you all that may be needed: medication, surgery, radiotherapy or chemotherapy. Your doctor will help you choose the best treatment, however, for you at that given moment of time. Well, this ends basically the short and brief one about Let's Talk Men's Health, testicular cancer. Give me the like for the thumbs up for support. Comment below if I missed anything, or comment below if you feel the need or have to. Feel free to subscribe to my channel. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to share these videos around to family and friends. Do what you love what you do. Until next time, thanks for support. Thanks for watching. I'll see you again soon. Aspie signing out.